diabetes, high cholesterol, those things. Arthritis is always there, but it's not part of that bread and butter. So this is probably going to be a little bit shorter, but I think it's really important. So the subtitle for this is, "Oh, My Aching Joints." Okay. So first, what is arthritis? Actually, first let me pray. Lord, thank you for bringing us all here safely. Thank you for offering me the opportunity to share the knowledge that I have. Thank you for preparing me, and thank you for preparing the hearts of those who are going to receive this. Let the words of my mouth and the meditation of my heart be acceptable in your sight. O Lord, you are my strength and my Redeemer. In Jesus' name, amen. Amen. All right, so what is arthritis? Arthritis is a general term. Okay, it's a general term for conditions that affect the joints or the tissues around the joint. So there's more than 100 different types of arthritis, and I am not going to talk about all of them, and I probably do not know all of them by name. But most types cause the pain and stiffness. Some types, such as rheumatoid arthritis, also affect the immune system and some internal organs of the body. So arth means joint, itis, inflammation. So arthritis is inflammation of the joint, okay? The prevalence of arthritis in the United States, there's about 54.4 million adults. So that's 22.7% that have ever been told by a doctor that they have some kind of arthritis. In South Carolina, it's 25.4%. So there's actually more percentage-wise in this state. My theory, not that anybody asked me, but my theory is because we have a lot of retired military, and the military is hard on the joints. So that's just my personal take on that. So the types of arthritis that we're going to touch on is osteoarthritis, rheumatoid arthritis, gout, and fibromyalgia. There's also a childhood arthritis, they call it juvenile arthritis, that I'm not going to talk about, but it is a very important disease in pediatrics because it affects the eyes and other parts of the body of the children, and it can be pretty debilitating for the kids. Osteoarthritis is the most common form of arthritis. That's the one that everybody has. They call it degenerative joint disease or degenerative disc disease. This is caused by wear and tear. So you find it most frequently in the hands from repetitive movements, the hips, the knees, the lower back. So what happens in osteoarthritis? The cartilage within a joint, it starts to break down. And then the bone that's under it, so cartilage is kind of like a cushion, right? So it starts to break down, and then the underlying bone begins to change. So those changes develop slowly over time, and they get worse. So it causes pain and stiffness and swelling, and then that leads to reduced function and disability. So there's lots of people who are not even able to work or do their daily tasks. You know, if your hands have too much arthritis, then you can't grip your toothbrush to brush your teeth, or you can't brush your hair, or you can't cook your meal, okay? So the signs and symptoms are pain or aching, stiffness, decreased range of motion or decreased flexibility, and swelling. So I know everybody's question is this: why do my joints ache when it rains? Okay. So the research on the connection between the two really isn't clear, and so scientists aren't really saying that this is a thing, but anecdotally it is a thing. When there's a rainstorm, the pressure in the atmosphere drops, and when your body detects that change, it makes your soft tissue swell up, and then fluid in the joints expand, and then the expansion and the contraction are taking place around those joints where the cartilage is worn down, so the nerve is exposed, right? And you get pain from nerve. So, the pressure makes the nerve get activated, and so you get pain. There's also a theory that just the change in the pressure is making your tendons and muscles and any kind of scar tissue expand and contract also. And so that's going to increase the pain. Okay? Risk factors for arthritis. So joint injury or overuse. So overuse injuries like knee bending, repetitive stress on the joint, playing basketball, running, jumping out of airplanes and helicopters, things like that. Age, the risk of osteoarthritis increases with age because you are using the same joint that you were born with. So as you get older, that joint gets older. Women are more likely to develop osteoarthritis than men, especially after age 50. I'm not sure why. Probably estrogen has something to do with that. It's usually protective for the bone, but maybe not so much for the joint. Obesity, extra weight puts more stress on joints. So particularly your weight-bearing joints, that's your hips and your knees. So that stress increases the risk of osteoarthritis. And then genetics, people whose family members have osteoarthritis are more likely to develop it. There is no cure for osteoarthritis. That's the treatment. So we just treat the symptoms with a number of different therapies. So first line is usually just saying increase your physical activity, move your body. And then there's physical therapy where the physical therapists help you to find muscle strengthening exercises that take some of the stress off your joint. Weight loss. There's medications, including over-the-counter pain relievers and also prescription drugs. And supportive devices like crutches or canes or walkers. And then if other treatments have not been effective and it's pretty severe, sometimes you're offered surgery. Okay. Imaging, you don't really need an x-ray to know someone has arthritis. There's if you know how to do a good physical exam, you can usually tell, or you can tell from the history, because 90% of what any medical condition is found from the history. We get our diagnosis more from the history than the physical. The physical is like the cherry on top, all right? So x-rays, if you get just a plain old x-ray, it does not show cartilage, okay? It just shows bones and spaces. But the cartilage loss is revealed when there's a narrowing of the space between the bones in your joint. So they can tell that the space is narrowed on the x-ray. It can also show bone spurs, which is kind of like extra little pieces of bone that develop when you have degenerative disease. And then there's the MRI, because it does show cartilage. It's not commonly needed to diagnose osteoarthritis, but it can provide more information, especially in the complex cases, to see if there's something torn or something else going on besides just arthritis. Some of the medications that are used, Tylenol. It can help some people if you have mild to moderate pain. It's important to know that you take more than the recommended dose of Tylenol, you can damage your liver. Non-steroidal anti-inflammatory drugs, NSAIDs. That's the class of medicine. That's your ibuprofen, your Aleve, naproxen, Advil. These typically relieve osteoarthritis pain because they're anti-inflammatory, and we've already said that it's inflammation. That's what the itis is. And there's other NSAIDs that are available by prescription. So NSAIDs can also cause stomach upset and heart problems, bleeding problems, kidney damage. So these things are over the counter and they're available, but they need to be taken as prescribed, okay? They also have NSAIDs that are in the form of a gel that you can rub on, and that's obviously less side effects. And then sometimes we use antidepressants for chronic pain. Cymbalta is one that's normally used. It's called duloxetine, and it's been approved to treat chronic pain as well as depression. So some of the other things that you rub on besides that, the NSAID that I talked about, There's capsaicin. So capsaicin is found in cayenne peppers. And they make it in a cream form, and you can rub it on. And what it does is it interferes with the release of the substance in your body that helps you feel pain. So that has to be applied with gloves, because if after you've rubbed that on, you touch your eyes or something, it's going to burn. Salicylates, that's what aspirin is. They can stimulate or irritate the nerve endings, so they distract your brain from the pain. And that's like Aspercreme or Bengay. And then there's menthol stuff like Icy Hot, BioFreeze. It creates a hot or a cold sensation that draws your attention away from the pain. So really, most of these are just trying to trick you, to trick you into thinking that your pain is gone. But it works. It works. but the one that's the NSAID is actually treating inflammation, and the capsaicin is actually treating the pain sensors. Then there's therapy. So physical therapist shows you the exercises to strengthen the muscles around your joint and increase your flexibility. Regular, gentle exercise, just walking on your own, is equally effective. So I find myself offering suggestions to people, because a lot of people say they don't have time to go to physical therapy. I don't have time, I got a job, I have kids, I have things to do. So we talk about walking, but it hurts to walk. Like if you have arthritis in your knees or your hips, then it hurts to walk. So me telling you to walk when you're coming in telling me I hurt when I walk really doesn't result in a very good interaction. One thing is people who have access to water, a pool somewhere, even if you can't swim, you can walk in the water, okay? Because that's taking the stress off of your joints. And there's actually extra resistance, so you're getting more exercise anyway, because the water is resisting you. So you don't have to exercise as long, but it is helpful if you have that opportunity, and water aerobics also. Physical therapy is usually for the lower extremities. Occupational therapy is usually upper and for arm movements and things that you have to do, like brush your teeth and all that. And so if you have arthritis in your hands or your shoulders, you're usually seeing an occupational therapist and not a physical therapist. So other procedures that are done, so you've tried to exercise more, you've taken some Tylenol and some Aleve, and you went to physical therapy and you're still hurting. The next step is usually injections that are going into the joint. So they do injections in the knee and in the shoulder and the elbow, and some people get them in their palm of their hands for the fingers. And they call them cortisone injections. What they are is they're steroid. Steroid is an anti-inflammatory. It's pretty much the strongest anti-inflammatory we have, is a steroid. The actual steroid that they use probably isn't cortisone. It's Kenalog, but it doesn't matter. So they do the injections. So these injections are supposed to last like 6 months sometimes, they say. It's not recommended to have more than 3 or 4 of these injections a year. So sometimes they work really well and sometimes they don't. And then, at least in the knee, they have lubrication injections. Because remember I said the cartilage is kind of like a cushion. So they have these gel substances that they can inject into your knee to kind of replace it or give you that cushion back. It's hyaluronic acid. And that's usually, it's similar to a substance that's usually found in your joint fluid anyway. So they can do that. And that's usually helpful. Sometimes the orthopedic surgeon has to just kind of go in there and look around and see if they can clean up some of that extra stuff that's in there that's inflaming things. They call that arthroscopic surgery. And then sometimes you need a joint replacement. You need a new knee, you need a new hip. They try not to do that on younger people because those replacements don't last for a long time. They wear out, they become loose, and then you have to get it done again. So what they do is they try to make you go as long as you can. you know, without getting the joint replacement. Some natural remedies that people say work, and I've had mixed reviews. So the capsaicin again, flaxseed, ginger, ginkgo, turmeric, they're all said to be good for arthritis, okay? The most popular ones for pain relief is chondroitin and glucosamine. I know you've probably seen those all through Costco and Sam's Club and Walgreens and everything. And those have been around for a long time, the chondroitin and glucosamine, because they're made of compounds that are found in cartilage. So you could try those. Because they say when osteoarthritis has worn your cartilage down, that the glucosamine is thought to protect what you have left of it. There's even some theory that it might help regenerate the cartilage in your joints, but there's not good evidence for that yet. All right, so that was osteoarthritis, and I spent the most time on that because that's the most common, that's the most likely one that we're all gonna get. I have mine, I know I have it, because I can put my hand on my knee, and if I move my knee, I can feel and hear a crackling sound, and if you can feel that, that's arthritis, okay? Rheumatoid arthritis is another kind. It's an autoimmune and inflammatory disease. It means your immune system is attacking the healthy cells in your body by mistake and causing a painful swelling in the parts of your body that are affected. So most commonly, we've probably seen people with rheumatoid arthritis where their hands, the knuckles on their hands have deformed. So they're moved to the side like this. And then they have like extra bumps or nodules on them. That's rheumatoid arthritis. It usually attacks many joints at once, but it's common in the hands, wrists, and knees. So the lining of that joint becomes inflamed and damaged, and it causes long-lasting chronic pain and deformity. It can also cause problems in your lungs, your heart, and your eyes. It's not one that's fun or pretty. They diagnose it by reviewing the symptoms, the physical exam, x-rays, and lab tests are important for rheumatoid arthritis because your body produces certain substances. And if this one is present, then you're more likely to have rheumatoid arthritis. And it's important to know that you have it because the treatment is different. It's treated with medications that slow the disease and prevent the joint deformity. And they're what I call like immunomodulating medicines. A lot of them that they use also in chemotherapy treatment too. Gout is the next one, or the gout, as I hear people say. He has the gout. All right. Gout is a condition known as hyperuricemia. So there's too much uric acid in the body. So the body, the body makes uric acid when it breaks down purines. And the purines are found in your body and in foods that you eat. But if there's too much uric acid in your body, you get these crystals, uric acid crystals, and they can build up in the joints and fluids and tissues, okay? It doesn't always cause gout when you have hyperuricemia. If you have too much uric acid and you don't have gout, you don't need to treat it. You just have it, okay? But gout can be very painful. It usually affects one joint at a time, often the big toe. So the times when the symptoms get worse, they call them flares. The times when there are no symptoms, it's remission, okay? But repeated bouts of gout can lead to gouty arthritis, which is a worsening form of arthritis. So if you just keep having recurrent flares, you have gouty arthritis, okay? There's no cure for gout either. But you can treat it and manage it with medication, okay? The risk factors for gout. This one is a risk factor for being male. Obese comes up there again. Having certain medical conditions like congestive heart failure, high blood pressure, insulin resistance or diabetes, poor kidney function. All of these lead you toward having a higher risk for gout. Using certain medications. So I just said high blood pressure makes you at risk for gout. Well, if you're on a diuretic for your high blood pressure, that also makes you at risk for gout. Okay? So it's all kind of a balancing act. Drinking alcohol. The risk of gout is greater as the alcohol intake goes up. So the more you drink, the more likely you are to get gout. Eating or drinking foods high in a certain type of sugar called fructose, and having a diet high in purines, because this is what everybody knows is, when I say, oh, you have gout, they say, oh, but I don't eat no red meat. Well, they do. But the purine-rich foods are red meat, organ meat, and some kinds of seafood. Mussels, scallops, trout, tuna, anchovies and sardines for our senior saints here. All right, so the treatment is to manage the pain of the flare. Now we're back to the NSAIDs, the ibuprofen, the steroids, and there's a stronger anti-inflammatory drug called colchicine that we give when you have a flare of gout. Interesting thing about colchicine is you treat it until they get sick. So you say, you take this 3 times a day until you're vomiting or you have diarrhea, then you stop. But it works. It takes the gout thing away. There's medicine that you can give to just keep the uric acid level down that you take every day. And then changing or stopping the medicine that causes it, like stop that diuretic for high blood pressure and give them some other kind of medicine. Sometimes that helps, okay? I think that's it for gout. Yes, ma'am.
Can you give us that food list again?
Yes.
Talk about the food for me.
So, red meat, organ meat, anchovies, sardines, mussels, scallops, trout, and tuna.
Can you explain the organ meat?
Organ meat, you know, organs, liver, kidneys, gizzards. What other brains? If you're eating brains.
So can we eat? We just got to stop eating. That's what you said.
Yeah, I think they're saying to eat chicken. Tuna is on there, yeah, which was surprising for me. Yeah.
All right, we got another question, Dr. Nancy.
Yes, ma'am.
What would be the natural foods for gout?
That's a good one.
The natural foods,
Yes.
like to prevent it?
Yes, to help with the pain in gout.
I think that they would be the same ones.
Gotcha.
Yeah, because it's you're trying to just not have inflammation. Okay, so if you avoid the ones that are causing gout, and then do the turmeric and those natural things, then you should be fine. Yes, ma'am.
Tart cherry juice, no sugar in it, works very well on gout. At least it does for me and my friends.
On what does it work?
On gout,
Oh,
cherry juice.
okay. I've heard lots of good things about tart cherry juice because it's got antioxidants in it. Yes.
Is it anything for any of these arthritis, just say for our grandkids, that we can start early if it's hereditary to kind of help them along?
Yeah, don't let them get obese. Have them move their body. That's pretty much all we have control over.
Wow.
You know, we move our bodies regularly, we avoid obesity, we eat smartly. You know, I hesitate to tell people to eliminate foods. I know I've said that more than once. But you can certainly do things in moderation and make things a special occasion kind of thing instead of doing it regularly. Yes?
My doctor told me to take 2 Tylenol a day
for arthritis, so do I need to stop?
No, you can take up to 4,000 milligrams safely, so you're fine. You can take 2-4 times a day, extra strength. Okay.
May I ask a question?
Yes, ma'am.
Does eating sweets affect arthritis?
Fructose, which is one type of sugar, affects gout. So eating some sweets can affect arthritis.
So is honey,
I think honey has fructose. I would have to look that one up, or somebody can look it up for me.
You said honey?
Yeah. Okay. Yeah.
Turkey with the gout, besides chicken or just chicken, what else?
No, I was being facetious when I said they're just telling us to eat chicken. Turkey's fine. Chicken's fine. You know, interestingly enough, it didn't say anything about pork. I'm just saying. I'm just saying, unless you're eating. It does? Okay, so my honey is 40% fructose. Okay. Yes, honey has that sugar in it that hurts arthritis. Yes. All right.
better than the cane sugar?
Yeah, I'm pretty sure it's probably better than the cane sugar. But I think in the big scheme of things, sugar is not the one to worry about for arthritis. Fibromyalgia, I know we've all heard about it. It's like doctors do not, this is one that you just don't even want to have to deal with. I'm just going to tell you. First of all, a lot of times when you have symptoms, you get relief when somebody finally gives you a diagnosis and tells you what you have. There's no relief with fibromyalgia because there's nothing that we really do about it. There's no cure for it. It's not explained well. You just have it. And now you have a name for it, okay? But I'm gonna tell you about it. Okay, it's a condition that causes pain all over the body. They call it widespread pain. You get sleep problems, fatigue, emotional and mental distress. See, this sounds like residency to me. So when I was a resident doctor in training where they had us working 80 plus hours a day, I had all of this: sleep problems, fatigue, emotional and mental distress, but it wasn't fibromyalgia. So they think that people with fibromyalgia might be more sensitive to pain than people who don't have it. Like you have a abnormal pain perception processing. It affects about 4 million adults in the US, that's 2% of the adult population. Cause is not known. So you get pain and stiffness all over the body, fatigue, tiredness, depression, anxiety, sleep problems, problems with thinking, memory, concentration, headaches, including migraines. Sometimes you get tingling or numbness in your feet and your hands. You got pain in your face and your jaw. Digestive problems. You got stomach pain, bloating, constipation, even like irritable bowel syndrome. Okay? So you get all of that and someone tells you you have fibromyalgia. So basically, it's a diagnosis of exclusion. You got to exclude everything else that there is that could be causing all of those things, and then the constellation of things still remains. Then you get diagnosed with fibromyalgia. They used to have where you do certain points of tenderness on the body, and if you had, I think it was 14 of them, then you had fibromyalgia. But that has, fallen out of favor. So basically, if you think someone has fibromyalgia, I would say send them to the rheumatologist and let them get worked up thoroughly and see if that's what they have. The medications include prescription drugs, over-the-counter pain relievers, aerobic exercise, muscle strengthening exercise, patient education classes, stress management techniques like meditation and yoga and massage, and encouraging good sleep habits, and cognitive behavioral therapy to treat the underlying depression. So it's like a talk therapy, but it's meant to change the way you act or think. So it's not just saying, oh, I have this going on, and they say, what else is going on? They actually give you behaviors and things to combat and help you with your disease. That is the extent of what I have today. And if there's any other questions, I am here. Can I just throw in my COVID talk really quick? I have to say this because we're living in this state that's only 43% vaccinated, and there's a variant out there called the Delta variant that's more virulent and it's more aggressive than the one that we had before. And even those of us who are vaccinated are at risk for this variant. But the greater risk is in the people who are not vaccinated. So if you have not gotten your vaccine, go get it. If you have a reason that you think is a good reason, please come to me with it so I can tell you it's not. You know, I will give you the science, or I will give you the personal evidence. I will give you something that you can take home and chew on and decide. And like I say to the veterans that I see who say they're waiting, I encourage them to set a deadline. Okay, you're waiting until when? Okay, I'm waiting until Thanksgiving, and if I don't have whatever thing happened, then I'm going to get my vaccine. So if you want to set a deadline, you can do that. If your reason is they're saying we need boosters, we've gotten boosters of every vaccine we've ever had. Babies get the same vaccine 5 times. Okay, we've gotten boosters of everything. There's not one vaccine I can think of that you only get once. It gets boosted. Okay, if your reason is they developed it too fast, they didn't. They've been working on coronavirus for years. They just had the specific one to focus on when the pandemic happened. So whatever it is, I encourage you to think past, you know, whatever the self thing is that's stopping you, and think of the greater good, think of all of us, and think of me, because I'm tired of wearing masks. Okay, I'm done. All right.
We got the version that we don't get at the doctor. Does anybody have anybody? See, my whole point and purpose of this is, and I just put it on Facebook, this is critical to ministry. And it is critical to the African American community in ministry. So she's here pretty much every Sunday. I've seen a couple people just go and talk to her. She is available, and it's not taxing your insurance. It's not taxing you. She's not asking you for $20. I'm going to say this as the shepherd of the church. We are doing ourselves an injustice if we do not use the education Dr. Campbell has. We don't talk to Dr. Flemming about our health. These are the 2 things that I talk about when I hit the floor, and I gave up my voice for your voice. And to you, Executive Pastor, Reverend Curtis, you all are doing an excellent job. And please keep pressing on and letting people know. So next third Sunday, if she should be here, bring somebody. If you have a prescription, especially when it's over 4 characters, you need to ask her, how do I take this medicine or what I have? Thank God we have a physician and an educator and a person that has compassion in the ministry.
Yes, ma'am. Me too.
Don't come in here with your meat bleeding. No, I'm serious. My grandfather was a diabetic. The founder of this church was my grandmother. And diabetes, as Mother Flemming knows, runs in the family. When you get those sores on your leg, back then when I was a kid, you had to undress those sores and see those open wounds. We don't need to have a member, we don't need to have anybody in our family, and we have a physician and an educator and a person of compassion. We got 3 sources in our ministry. We need to let Hodges and Greenwood and McCormick and everybody know. Shut up, come and listen.
Amen. Amen.
Don't complain about what you don't have when God has provided us that. And if you get the COVID, pray, it'll take you to so far.
Okay.
Amen.
Amen.
But if you choose to pay co-payment, you can see me.
She's a mess.
I love it, I love it,
All right, I think
All right, thank you so much.